Hello to all those interested in medical sciences. Today on channel MediX, we are following together an important topic of pediatric patients called the path to diagnosis of infectious diseases in children. This slide outlines the 3 steps that the medical staff must take to reach a diagnosis, each of which is complementary and will be explained below. First, complete history and description of past medical conditions and illnesses. Second, complete physical examination. Third, the most important diagnostic tests. We will review the first of the methods for diagnosing infectious diseases in children. A detailed and family history, which includes asking questions from parents or children, if possible, about past illnesses in the family, especially parents and brothers and sisters. Previous vaccination history is very important and gives us the result of which germs the case is resistant to and which germs it is sensitive to. Other factors include a history of travel to endemic areas of the disease or a history of contact with disease-carrying animals, etc. Slide. We see the second method of diagnosing infectious diseases, which includes a careful physical examination of the child. Which includes checking the patient's fever and pulse and ruling out the occurrence of systemic shock as a result of widespread infection. Fever can be of 2 types: local, including swelling and local sensitivity, or systemic. Systemic fever is not always associated with infection. It may be the result of rheumatological diseases or poisonings or enteric fever, etc. Also, in severe infections, they may not have a fever or be hypothermic. The second thing that is very important is a careful evaluation of the ear, nose, and throat, which by evaluating these cases can diagnose common childhood diseases such as otitis media or upper respiratory tract infections. The third case, request for medical tests. These tests should be performed according to clinical needs and evidence. The most common tests include the evaluation of acute phase factors, such as ESR, protein C, which are mostly requested to assess the response to treatment. Another case, request for CBC, which can be requested for infectious diseases. One of the diagnostic features of CBC is leukocytosis and early neutrophilia, which is temporary in viral infections and then turns into mononuclear cells, and in bacteria we have more neutrophilia. Another diagnostic feature is eosinophilia, which can be seen in the test in the case of allergic diseases or the migratory phase of parasitic diseases. Slide mentions the use of medical imaging to complete the diagnostic needs, which we request only in the presence of specific clinical evidence. One of these is ultrasound, which is a non-invasive, radiation-free method used to evaluate solid organs. The next method is CT with contrast, which is good for evaluating bones, as well as complicated chest infections. The next method is MRI with gadolinium contrast, which is used to evaluate soft tissue. Thank you for your attention. I hope the content in MediX was useful. Send this video to your friends. Thank you. Goodbye.